Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NALBA for short. Thank you for joining us for today's series called Pláticas, Latino Wellness During COVID-19. NALBA is a nonprofit agency dedicated to the well-being of Latino families and communities in New Mexico and across the United States. Our mission is to address the disparities affecting the behavioral health of Latinos. NALBA is excited to host this Facebook Live series on how Latinos and their families can and do take care of their emotional, physical, and spiritual well-being during COVID-19. Join me today as my co-host, Dr. Susie Villalobos, who will be joining us and introducing herself today shortly, as well as our presenters. So welcome, Dr. Villalobos. I'd like to thank our strategic partner, Morehouse University School of Medicine, for helping make this series possible. Each month in 2023, NALBA will host a professional expert in public health, behavioral health, and the field of medicine, as well as advocates and other community individuals, members, and providers to share their insights, their experience, their expertise on how to take care of yourself and your family and your community during COVID-19. We also want to learn about what resources are available. Today, we'll be listening to a powerful panel of guest speakers who will talk about their work here in New Mexico through a program called WEAVE, which we're going to learn a lot more about in just a little bit. We want to make sure we give them the opportunity to talk about the phenomenal work they're doing to ensure that we, as Nuevo Mexicanos, are getting the opportunities to give our insights, our perspectives about how to stay well and protect ourselves during this particular pandemic. Well, we're going to get started. So here's how the Plática works. We have several questions that we have prepared. So Dr. Susie Villalobos and I will be taking turns asking our great panelists to respond to these questions. We'll also be asking you as the live Facebook audience to chat in our live session so we can ask questions or share your comments with our presenters. So let's begin. So I'm going to ask our esteemed colleague, Dr. Susie Villalobos, to please introduce herself and then introduce our speakers. And then we're going to jump right into the questions. So Dr. Villalobos, welcome.
Hi, Fred. Thank you so much. I love these opportunities to actually get a chance, informal conversation with some of the colleagues that we work with from NALBA, and so many years that we've known Dr. Lisa Cacari Stone, and finally having her on one of our Pláticas. It's so exciting. And then, of course, our other esteemed colleague, Dr. Nancy Pandhi. So good morning and good afternoon from wherever you're viewing us from. My name is Dr. Susie Villalobos. I'm currently the project director for the National Hispanic Latino Addiction Technology Transfer Center and the Prevention Technology Transfer Center. I'm also a project director for NALBA, working on this wonderful WEAVE project here in Doña Ana County. And I get the distinct pleasure of introducing our wonderful guests today. So if you'll allow me, I do have my cheat sheet. So because they are so esteemed, they do have a very long bio. But I'll go ahead and do the introductions. I'll start first with our principal, and one of our principal investigators on the WEAVE project is Dr. Lisa Cacari Stone. Dr. Cacari Stone has dedicated over 30 years to population health science aimed at advancing health equity for diverse, racial, under-resourced, rural, and Latinx and immigrant populations. She brings direct experience in health policy, child and social welfare as a former licensed behavioral health provider, director for a home visiting child welfare program, director of senior services, executive director of a rural federally qualified mental health clinic, state health officer, and federal women's health liaison with the U.S. Department of Health and Human Services, and policy fellow with the Health, Education, Labor, and Pensions Committee and Senator Ted Kennedy. Her scholarly portfolio is comprised of over $26 million in grants from private and public funders and encompasses the macro level determinants of health to the community level, to the interpersonal level role of promotoras de salud in bridging patient-provider communications. She has written multiple articles and policy reports and delivered over 100 research presentations to academic, community, and policy audiences at the national, binational, and state and local levels. Dr. Lisa Cacari Stone came to UNM after completing prestigious fellowships with the top thought leaders in social determinants of health at Harvard and training at the top-rated Health and Social Policy School at the Nation Heller Brandeis University. Welcome, Dr. Lisa Cacari Stone. Our other esteemed colleague is Dr. Nancy Pandhi. She is a physician scientist whose primary focus is improving the delivery of ambulatory care to vulnerable populations through participant-centered engagement approaches that are implemented both at the individual and organizational level. She is currently the co-associate director for the Clinical Translational Sciences Center and the vice chair of research. Her research program focuses on health experiences research and incorporates a systematic qualitative research method that is integrally tied to disseminations. This method results in products that have a variety of potential secondary uses ranging from future intervention planning, quality improvement, policy influence, and clinical education. She is a part of the faculty at the Center for Native American Health, focused on supporting initiatives and research proposals that improve the health of indigenous, I got that word right, individuals and communities. Welcome, Dr. Nancy Pandhi.
Wow. Those introductions were powerful, Susie. So all I could say is there's no doubt that we're in awe of the experts that are here today, but I want to personalize it, right? It's important for us to always stay grounded in who we are, our communities, because really at the end of the day, we continue to live and work and play in our communities, and we're not just colleagues, but we're part of our community. And I've known Dr. Lisa Cacari Stone for a number of years, and if you notice, I didn't say how many years. But what's important is that in her trajectory in her career, she has always lived and felt the disparities we talk about, because she knows this firsthand through all her professional career. But she has been a leader, and not just a thought leader, but a doer. And that's a big distinction, right? Because it's really about how do we achieve equity. You can't achieve equity if you don't really do something. And the work that she's done with the WEAP program is phenomenal. This really speaks to the national impact of the outcomes of this work. And we're blessed and fortunate that she's been leading this effort in a way that all of us just greatly admire. So just wanted to make those comments, and we're going to get ready. We have questions here. So we probably may have not said any of the things that Lisa would have probably have said, but we're going to ask her to say a little bit more about herself. And then Dr. Pandhi, I'm going to ask you to do the same. And then we're going to start going into all the other questions that Susie and I will be asking. So Lisa, please tell us a little bit more about yourself. That would be awesome.
Thank you, Fred and Dr. Villalobos. I want to just give a saludos to everyone on Facebook Live today. I have to say, we learn from the best. Many of us follow the trailblazers who have led the path, our ancestors, our abuelas, abuelitas, abuelos. And Fred, I've learned from you. NELBA has grown to be a very distinct, trusted national organization. And Susie, it's been an honor to work with you on this project, and also with Dr. Pandhi. But we learn from our ancestors, we learn from our familias, and everyone on the call who practices and gives their heartfelt work and dedicated love. What do they say? Love, social justice is love in action. So I want to start with that. Just a quick, I am here at UNM, but I have been a licensed marriage and family therapist in practice in the field. And I just say that New Mexico has been the honor to be here, to live here, to work here, but to have national binational partners. University of New Mexico is a platform. We're a Latino Hispanic serving institution. It's a platform for mentoring our next generation. It's an obligation to conduct research in a way that engages our students, our staff, our faculty, our communities to seek and create knowledge both scientific from the academy and from National Institutes of Health type of knowledge, but knowledge from our communities, because the communities know the solutions and those who live it every day know where the answers lie. So I just thank everybody. And I'm excited to share what we learned, and we'll be looking for the chat. I want to know what you're doing as well. Thanks.
Yeah, and I can follow. So I'm really delighted to be here as well. That behavioral health is near and dear to my heart as a practicing family physician. So I'll start with that. And as somebody who's worked in community health centers for the majority of my career, really knowing the work that the frontline that's amplified by those in the community, and the resilience that's there, and also the challenges that go hand in hand. And so that's why this topic is so important. As a scientist, with that other part of my life, I've had such privilege and to really bring in lived experiences. And that's what my work has been about, is how do we really bring that diverse experiences from the community and amplify that in order to make health better for everyone. And so with that frame, I think, that really is the passion behind my work. So I'm so excited to hear from those who are joining us live as well. And as part of this project, it's been an honor to be engaged and be led by Dr. Cacari Stone. So I was very privileged to be part of this work thus far.
Well, Dr. Villalobos, what a great opportunity today is, huh?
Oh,
So
yeah.
she's already ready with the questions, so I better not take up any more time because she's already got her questions ready.
Yes, I do. Do you want me to go first, Fred? I would love to go first, or if you want to answer ask the first question.
I think you need to run with this. I just need to kind of get out of the way,
All right. I'm going to go with Dr. Lisa Cacari Stone, and then of course Dr. Pandhi, you can answer as well. Can you tell us a little bit about the Weave New Mexico project, the people involved, the partnerships, how this all came about, and some of the work that we're currently doing in 2.0?
Thank you so much. Yeah, people, place, and partnerships. Wide engagement for assessing COVID-19 vaccine equity is actually supported by our National Institutes of Health. NIH is under the U.S. Department of Health and Human Services, as is SAMHSA and other organizations folks are familiar with. We are funded by a project. We have 20 sister states, and I know you are going to post in the web or in the chat the other states and access to the National Community Engagement Alliance. Some of those states I just want to give a shout out are traditional Latino, high density, Arizona, California, Florida, Texas, New York, Illinois, Puerto Rico, and also new and emerging immigrant Latino communities, including Georgia, Arkansas, North Carolina, and Louisiana. So I encourage those on the call, if you're from those states, to also reach out to your SEAL partners there, possible collaboration. The project has wide engagement. We're statewide. Some of the projects in our sister states focus solely in large metro areas or particular communities or populations. Our vision and our core value was that New Mexico is a very diverse cultural state and we can learn from each other. And while we're looking at what we call the social ecology of vaccine equity, in other words, the various determinants of why people got vaccinated, as well as the barriers like trust and mistrust, we're considering our findings to really elevate the voice of those most impacted by structural inequalities before the COVID-19 pandemic, and also the added resiliencies and strengths and assets of our communities that give us insights on public health infrastructure improvements, systems, healthcare provider, behavioral health opportunities for growth in our systems, both in New Mexico, but what we can learn nationally, and policy change. Our Weave in New Mexico embraces what we call racial equity outcomes. We want to achieve changes in looking at structural racism, historical inequalities as they relate to vaccine equity, and look at some public policy outcome. We want to advance and help change the narrative around our communities. We know that when COVID first broke out as well as through the entire process, including today, we often don't focus on the stories, at least at the national level in public media, of our diverse Latino communities, as well as Native American, African American, and other rural, urban, and Asian communities. We also want to change those social institutional practices. In this case, what is it that we can learn for behavioral health improvements, both in treatment and prevention, and then really focus on advancing and promoting and protecting cultural linguistic assets. So we have multiple partners. We have the New Mexico Black Leadership Council. We're proud that National Latino Behavioral Health Association is a key partner. We also have an LLC in the South, Cultivando Comunidades, working with Annabelle Canchola as well, and the Promotora Network in the South, First Nations Community Health Source, and Center for Native American Health, and as well as some statewide partners. And I'll end there, but our goal was to really look at 3 legs of understanding inequities and experiences of our diverse African American, Latino, urban, Native American, shelterless, homeless communities, diverse Latino, border colonias communities, and other underrepresented communities as well. So we have a survey that we've conducted, and Dr. Shannon Sanchez from New Mexico couldn't join us today due to some family health priorities. Dr. Pandhi she'll be speaking to the Catalyst films and interviews with providers. And then we have digital stories. We were able to engage 34 folks from around the state with Marita Jones, who trains on digital stories. A shout out to Healthy Native Communities. If anyone's interested in consulting with her, she's online and trained people to tell their own stories and develop their own films. And of course, Susie and the Promotoras in the South were very instrumental in helping recruiting those who developed their stories. And if we could post that digital story link to our website, that'd be great. Thank you for that question, Susie.
Yeah, thank you, Dr. Lisa Cacari Stone. Dr. Pandhi, do you want to add on to what Lisa just kind of gave us a little bit of a snapshot of what all has been going on with Weave?
Yeah, certainly it's been a lot. And so I think what I can do is just do a quick focus on the Catalyst films, which was the part that I was involved with. So just expand a minute on that. And so the Catalyst films was really a way to showcase the experience of frontline clinics that were working with the communities that we heard about. So we worked with La Clínica de Familia, and we also worked with First Nations Community Health Source, and we worked with them to really partner in terms of highlighting what was going on, both on behalf of the individual providers, and that included behavioral health providers as well at both of those health systems, and people at the front desk, but the entire healthcare team could be part of this experience. And they shared their stories both individually about what it was like to be in this space during this pandemic time, and what it was like for the communities that they served as well.
Thank you, Dr. Pandhi. I just have a follow-up question, if you don't mind, because not everybody is versed in all of the language that we use when we're doing our research and are on this project. Can somebody give me the difference between a digital story and a Catalyst film? Because that might be of interest for those that are not familiar with the Weave project, and how that voice is going to advocate for some of these layers that Dr. Lisa Cacari Stone expressed initially.
I can take that.
Yeah, great.
That's all right. Yeah, so a digital story is really people getting training to create their own story, right? And they get support to storyboard their own personal experience and make a film about it, whatever aspect that they want to emphasize for them. And so and with a Catalyst film, it's a little bit different, because what we do is we have interviews with people where we say, tell me your story about what it's like. And then there's a team that works together to understand what might be similar across those experiences and what is different, and put that together with different topics. And we do that in partnership with many community partners to pull out those aspects of the stories that might be most powerful and able to create change. So they're both wonderful methods, and they show different. One is very personal and individual, and I would say the other one as a catalyst is kind of looking across multiple people, and both of those, though, hoping to inspire some future dialogues and areas of action and lessons learned.
Oh, thank you. Fred, do you want to ask the next question, or
Wow. Oh, absolutely. Oh, yeah, I've got my questions too. I'm ready. So
I know.
we're ready. And I sure did enjoy hearing you reference people telling their own story. So you're really tapping into a traditional method that's been around for hundreds of years. And that's this notion of how do you have conversations with the people in your community or in your environment so that they can feel that they're a part of the exchange, right? So there's a mutuality to the conversation, right? And so when people get to tell their story, they're so proud of it. They have so much to say, as opposed to having rigid systems where what happens is it's almost dictated to them how they should speak or what they should say, and it gets very rigid. People are natural storytellers, and it taps into their cultural strengths, right? It's an old tradition, right? Having these exchanges and how do we pass information on, and that's the depth of the work that you're doing. And I appreciate using those culturally and linguistically appropriate methods, because what happens is that people love to be engaged. And when you honor them by listening to their story, it's what now the cultural humility learning objectives are about, is for us to listen to what people say and give it credence and the respect that it deserves, because communities know exactly how to respond and engage themselves. And so my question speaks a little bit about this. Now that we know what the impact of COVID-19 has had on diverse communities here in New Mexico, particularly, my question to you is, how do we think about resiliency from a holistic perspective? And so there's three key things in that, right? The diverse populations, the nature of resiliency, and then lastly, what's unique from a holistic perspective, because that adds a different dimension, right? As opposed to the more traditional methods, right? Because what happens is that the traditional methods have been around for a very long time. They were oftentimes suppressed, but now here's an opportunity for us to understand the significance, the value, and the power associated to how people self-care, how people in fact cope, and how people in fact respond to accepting what interventions are available to them, right? Because we oftentimes forget about the healthcare domain of acceptance of services, right? And we find that oftentimes when people don't accept the service, they don't come back. So that question really, again, relates to, what do you both think really accounts for the resiliency of our diverse communities, and how does the holistic perspective play into that?
If it's okay.
Let's go back in alphabetical order, right? Lisa goes next.
Okay, right. Thank you for that question. And, I want to go back to the power of story. When many of our communities as diverse Latinos come from indigenous, whether you're from the Taino indigenous tribe in Puerto Rico, or you have more indigenous cultural roots, Afro-Latino, as well as here in New Mexico, there's lots of mixed blood. And one of the things that happened in colonization is, the colonizers burned all the codices and destroyed our documented histories of our medicine. And that continues to happen when knowledge is suppressed, local knowledge, cultural knowledge, intergenerationally. And one way, as we think about resiliency, we can think about 500 years of resiliency or more for many of our diverse communities. And I say that to honor everybody on the Facebook call and where you come from, is that story is the way we inherit the what we call counter resistance, or what we call positive critical consciousness of our communities, and we pass on to the next generation core values to live by. So on that note, when I'll speak to the digital stories, again, you can go to the link. I believe there's 34 posted. We had 37 from urban Indian, shelterless, to border colonia Latino, to African American, to Dene Navajo. And I'll highlight some of the insights across the state that might resonate in terms of what we think about resiliency with our Latino communities. Resiliency, there's no common definition in public health or in behavioral health, but we do know, Fred, it's exactly what you said. If we think about it from a holistic perspective, it's not about returning to a state of being that we had before, because when it comes to BIPOC, Black, Indigenous, Latino, and other communities of color, and LGBTQ communities, our current state of health and well-being is compromised due to structural inequalities. So we don't want to return to some state that is already compromised because the systems of oppression haven't worked to advance our holistic well-being. We want to invest in resources from federal agencies, foundations, private sector, community, local city, policymakers. We want to invest resources to protect and promote what we know is cultural positive practices that we have. Many people over the years have talked about the Latino epidemiological paradox. It says, you know, the literature has looked at this question of, well, why do Latino women, particularly Mexican immigrants, Mexican women, have good birth outcomes? So we've been studying that positive protective factor, but what have we been doing in terms of systems and investments in protecting that? So the stories of resiliency that came from our communities look at time oppression and the opportunity COVID paused things and gave people time to be with familia, right? So how does time promote holistic health? And how can time, when we have a pause, promote the ability to have focus within and with our families? The other part is resiliency is based on the type of information we could get or the misinformation. And we know that a positive aspect of resiliency is having a network of trusted messengers, providers, promotoras, family members, elders, to get the information we need in the way we need it, but accurate information. We know there was a lot of what we call, right, myth or misinformation going through the network. So it took several years to kind of maybe get the science, what I call the community science, right, in terms of, can we trust vaccines? Can we trust it for our children now that they're out? So if we have a abuela who says, hey, I got it, or we have a mother that says, we got to protect our elders, let's all get vaccinated, that really mattered, or a doctor. The other part of resiliency is being able to trust government. Many people on the call and the network through NALBA are from different states, and there are various state policies that were implemented. Were they able to trust that social distancing, masking, social distancing is hard for us as Latinos, but did we trust enough that this would actually help us? Do we trust the government that the vaccines are safe? These were important parts of the stories that came out. And again, the trust was through the network of the people we know. And then having the right resources, access to care, to the hospital. Some of the digital stories spoke to, and Susie knows this, one young woman, and it's public, they gave us permission, talked about losing 4 or 5 family members due to death. And that wasn't due just to COVID, it was pre-existing conditions, but not having access to a hospital, not having access to much of what's needed. And a common theme across the state was the need to take care of spirit, emotion, the behavioral health part of us that's all encompassing, not having access to that, people were turning to their traditional ways, the connection to the land, the relationship to the land. And I'm not just talking about some of our Native American digital storytellers, but also to our Latino ones, and the connection to each other. So that was critical. And I'll stop there, but cultural identity, cultural preservation, and respect for oneself was also part of resiliency.
Oh, wow. Yeah, that's really powerful. Thank you for reminding us and referencing the emotional health aspects of what all of this means. As an organization, we saw the kind of the significant impact that continues on deaths and grieving, given the nature of the bereavement process, and how that significantly impacted people's ability to naturally engage in the grieving process. That's, in particular in Latino communities, very significant in light of our beliefs around death and the nature of how we grieve. The practice of despedidas was interrupted and still remains interrupted, right? The despedida is a cultural practice very common in the Latino community, and that was really utterly shattered because people weren't allowed to be in the hospitals or in proximity to their loved ones. And when they passed away, there was no traditional mechanism for sharing your farewell, right? And so that has now left an imprint in people's thought patterns about when people's anniversary dates come up. So those patterns then now need to be able to have new ways of exploring how do we grieve in light of that interruption. So that was powerful, Dr. Lisa Cacari Stone. And Dr. Pandhi, I think you probably want to weigh in on this too. So I'll let you kind of weigh in on that aspect having to do with the diversity, resiliency, and holistic question. So
Yeah, so many of what we heard echoes what Dr. Cacari Stone said, but I wanted to expand on a few different things that happened in the clinics. So when we think about people who are on the front lines in our clinics and other frontline care workers, they didn't get to stop, right? And I think that's something that really came out in our films is just how can you be resilient? On one hand, you have that compassion because you're meeting the needs of what's out there. That's why they're frontline workers, right? You go out there and you're necessary in an experience like a pandemic. But at the same time, then, how do you temper that with sort of thinking about the long haul? So our providers and other people in our films talked about how difficult it was because originally everybody went in with this kind of, oh, we're going to do what we can and, really meet that need for their own communities. They felt this so strongly, and then over time, after it was weekend after weekend where, they were giving up times that might be there to rest, it started to take a toll. So, what the resilience came from, I think, was one linking into the fact of like the impact that they were having when the vaccines came out, that sort of, joy of being able to be part of getting this out there to try to stop the pandemic, and also realizing, once it became very apparent that this was something going on for the long haul, the ability to really say we need to sort of heal ourselves, right? And that's not sometimes traditionally part of the cultures when you're in the front lines, especially in different healthcare settings or other settings. You're always kind of out there as that healer space, but you also have to heal yourself. So that was a very key lesson, I think, that came out. The other thing I wanted to talk about a little bit was about, the wisdom and trust, because those were key strategies that were really needed in terms of resilience. So, we heard about this as well, but, in the Catalyst films this came out, there was a very powerful story of a traditional healer at the First Nations Community Health Source Clinic who reminded us that, what had happened was the elders had been saying, we kind of treat our homes like hotel rooms, right? We stop in and we look around and then we go back out into the world. And so, again, that sort of balance that came up in terms of, what are we here for? How do we use our place in our community, which I think resonates sort of across multiple communities as well.
Wow, that's powerful. Well, Dr. Villalobos, I know you are just chomping at the bit there, so I better make sure you get to the next question because this has been such a lively exchange, and more importantly, to be able to listen to how the WEED program has really taken the time to delve into communities and giving them the respect to be able to not only share their stories, but how does that inform us? And what does that now help do to inform our next set of approaches or practices? And so we'll get to learn more about that. But Dr. Villalobos?
Yeah, thank you, Fred. There's a couple of things that Dr. Cacari Stone and both Dr. Pandhi mentioned in their answers to your previous question that's kind of leading into my question. I just wanted to add to something that Dr. Cacari Stone mentioned, and also Dr. Pandhi, is we really took the time when we started this research project to understand what was needed from the community to gain their trust. It wasn't just a matter of them coming into a research project like we normally do, taking that information and never going back to them to relay what we identified, what was analyzed, and what was fruitful from what we took in terms of the analysis of not only the survey, but the digital stories. And now we're working with Dr. Pandhi on the Catalyst films. So in some of the things that Dr. Cacari Stone mentioned, investing in the positive cultural practices and also some of the advancing holistic well-being. My question is, how can data justice and data democracy advance vaccine and overall health equity in New Mexico? For instance, how can the findings from these particular digital stories, interviews with the providers in the Catalyst films, and the survey research inform public health practice and also public health policy?
Thank you for that question. We wanted to inform and have an impact. Let's talk a little bit about what do we mean by data justice? Traditionally, research hasn't been conducted by institutions, government institutions, in a way that, or the private industry like pharmaceutical companies, hasn't been conducted in a way in which community-based knowledge is valued, right? Also, sometimes research is not necessarily conducted historically in a way that's transparent. We know there's cases where, for example, my colleague and I wrote a piece on conducting research with Latino communities. We don't have community advisory boards like the Navajo Nation has in Window Rock. They have an research ethics, human research ethics council that has to review all the research done with communities. We need more of those. Some nonprofits, maybe those of you on the Facebook call today, work for a federally qualified health center or behavioral health center where you have to get permission, and you have a council or a community council that oversees research being done in a particular catchment area and community. So we don't really have that as Latino communities. If you have it for an organization, that's great. We need more of that. So part of data justice is answering the question and demonstrating through what you do, not what you say you're going to do, of how the research you're conducting benefits the community. If you can't answer that in a way that your abuela or your primo or your network feels convinced that it's going to help them, then you're you have to start from square one. You have to demonstrate that you are going to conduct knowledge in a way, research in a way that produces products, knowledge and information that people can use. So I think that's the first step of data justice, and to build that trust. It's hard to do research on COVID. We're doing research on the lack of trust in research. So one way we did that right in terms of data justice is who are the brokers of that knowledge? Who are the trusted individuals? So I think working with Promotores de Salud and Community Health Worker Network, like in the South, which we did, Susie, and some of the statewide partners, is they're valuable leaders that people know they can trust. So, and then we have built into our project check-ins. We have a weekly meeting. We had one this morning with all our core partners like NELBA, Cultivando Comunidades, like First Nations Community Health Source. From day one, like the Tri-Chapter area, the Navajo Nation, the Dene Partnership, where from the whole design of the project to right now interpreting and making decisions on how products are developed and how they'll be used has been very participatory. Dr. Pandhi can speak what she did today with the catalyst films, and Susie knows, Dr. Villalobos knows, we sit and, we've promotoras, our partners, our core partners have had input on the survey. NIH has required questions on the survey, but we've developed some of our own questions that are important to our communities. We have what we call a quarterly community practice network meeting, which is 200 plus and growing folks around all of New Mexico, where we share what we're doing. We've shared the digital stories, we're sharing the catalyst films, the survey findings. So we want that to be, and our website has all the products. And now community-based partnerships, like the Border Latino team that Susie's on, are making decisions on what kind of products are we going to develop, and also co-analyzing the data across all three. So when you have those trusted cultural knowledge brokers looking at all this the whole way, it's what we call, transparency and also humildad. Having the sense of, I can bring my best talents to the table to make this a project of integrity that benefits the community. But when the promoters say, hey, this question didn't feel right, and when we ask community partners, we have to have enough cultural humility and say they are right, we will listen to them and we will change it. And to me, that's what data justice, it's a process, and it's rooted in humildad and for the value of different ways of knowing or what's going to make a project better. And that's what research is about. It's about bi-directional, it's about mutualismo, having mutual benefits and relationship.
Thank you, Lisa. Nancy, did you want to have an opportunity to answer that question as well?
Yeah, so I'll talk a little bit about that from the frame of health experiences research, and this might be a time to post in the chat some of our principles with our health experiences research network that I am part of, which is the methods we used for the Catalyst film. And so for that, a basic principle can be like nothing about me without me, right? And that sort of simplifies this idea of what we need to be doing with research. I feel so strongly about that, and I think and many others do as well. And so if we want to have our research to have an impact, it's so important that the research is co-created with people who are the ones who are part of the impact where it needs to occur. And so for the Catalyst film specifically, the ways that we showed up was to really, at every step of the process, you've got advisors that are drawn from the communities that we want to have the conversations with, and the SEAL overall structure very much lends itself for this method to doing that kind of work. With our stories, when we have those stories, one of the things that was really important is that to have a sense of safety and a reciprocal relationship. So the person who is sharing their story received the story back before it was ever part of the research and read through the transcript. They could watch the film, their own films, and say, oh, I don't want to use that part, or this part's okay, and they had, if they wanted to not show their face, that was fine too. So they really told us exactly how they wanted to be part of the film as well. And I think that's really important as we do research, is to take into account, the ways that people who share the gift of their participation, the ways that they want to be a participant in it. And that was one of the values, I think, that was so much holistic across the different aims of this project. And then I wanted to just come back overall back to the power of story, right? And I think, as we think about impact, we know that stories have impacts in two different ways, and there might be more, but one is you identify, right? This person is really like me, and this is something, and oh, I can see myself in that. The other is that you get transported. Somebody's story is powerful. You sort of set aside your own beliefs and you get transported by that. And it gives you an openness to learning and be flexible. And so I think this also plays in as we think about community wisdom and kind of resiliency at that community level. How are we collectively kind of going into this with the flexibility to have that sort of dialogue, be transported, and think about new ways of doing things.
Well, thank you, Nancy. Fred, I didn't know if you had additional questions in the Facebook chat or if you wanted to ask your next question. I can't believe the time has flown. We only have 15 more minutes.
I know.
I could stay
Well,
with these sciences forever.
I know. Well, I know it really says something, and the beauty of a plática is it allows people to just be expressful of, what they sense about this exchange, right? And it's not just refreshing, but it's so powerful and meaningful to actually see that community is really part of the cornerstone of this effort. Because oftentimes community is an afterthought. Community is seen as, oh my God, we got to work with those people and it's going to take forever. Or we're going to have to figure out how do we engage with them, but we don't really know how. And there's all those questions that any researcher or any institution will have about how to effectively and culturally and linguistically engage with communities, given that everything about science is studying about what happens that's in real life. Right, or what is it that we study about the very existence, the phenomenon of humanity? Well, it's what life is, right? When we get to study it and research it, and so it's very powerful to actually see that this is such a cornerstone to engaging with diverse populations who are really still questioning, will we achieve equity? Because if you think about it, you have to undo so many hundreds of years of inequity in order to work in a different direction. But to support that, sustain that is very significant. And the institutions can help do that, right? It's a powerful change for them, but it's really how community can really feel part of change because we're given the respect, the dignity of participating in these kinds of studies. And for me, that's a very significant impact of the work that you've done with Weave. And of course, Weave by no means is in isolation. As you said, Dr. Lisa Cacari Stone, there are several other states that have similar programs. They all get to learn from each other as cohorts about what is unique to different states and different programs. And certainly for us, I think at NALBA, our particular interest is to be able to share and disseminate the work that you all have had. And we will have opportunities within the national network called the National COVID Resiliency Network that's hosted and managed by Morehouse University to learn about this work. And we'd like to be able to share all of this work and this information with them as you continue to progress, because we currently work with them, but at the same time, these are two different timelines, but we want to be able to keep them up to speed on this work because it helps to inform other national partners in that network to learn about what has transpired with the Weave project. So our job is to be a platform, a vehicle, and a venue for the kind of work that you're doing. So I want to acknowledge you for sharing all of this. And yeah, Susie and I are probably saying, oh my God, how will this plática come to an end? Well, here's the opportunity to have you tell us really what we can anticipate for the duration of the project, so people can then be ready to hear more about that when we do get to a point we can hear what were some of the outcomes and the final impacts that were learned from this process. And so, whatever today's takeaway is for you, please, we'd like both of you to share that and feel comfortable knowing you can cover some ground of something you didn't get to say earlier in any of the other questions, but what are the takeaways that you want the listening audience to hear? So when we post this recording, we're going to boost this particular posting nationwide in order for folks to actually keep hearing this message about resiliency and the impact of the WEAVE program. So tell us, what are the takeaways that you want our listening audience to take away from today? So Dr. Cacari Stone, if you wouldn't mind helping us with that.
I think the first takeaway for me is gratitude, and gratitude for many of our own communities and families, showing the resiliency that we have. With many of us have had complex grief. We see that complex grief is a key, common, shared human experience across the state as we talk to providers or community partners because of pre-existing traumas or losses, as you mentioned, Fred, and then the need to have ceremonia or have the traditions of going through that grief process and coming through it still together. I think the other major takeaway is that we have regalitos for you. There's regalos on the website. The community members who are the storytellers have agreed to share. Those are available. They could be just a way, as Dr. Nancy Pandhi talked about, just connecting to other stories as of in the behavioral health circles. Those are available. I know the Catalyst films will be posted soon. We're producing chart packs. Dr. Villalobos and others have already presented at the National NELBA on some of our survey data, but there'll be more. We're going to have another regalito, what we call scrolly telling. Your storytelling by scrolling through snippets, and community partners are developing those with the African American urban community, with the urban Indian shelterless, with the border, and it's going to combine the data with the Catalyst film snippets with the digital storytelling. So you can count on that's our way to give back. We want to share knowledge so it advances social change and healing. And we'll be in touch with that. And we're just very honored to be working with NELBA and amazing partners. And we're doing this, like I said, because we want to advance knowledge for the benefit of our communities.
Beautiful. That's powerful. Well, Dr. Pandey, I'll have you share what you want the takeaways to be from today.
Yeah, so I would first of all just echo the gratitude and the opportunity and to be part of this project and this work and working with these amazing communities. I also wanted to say that, you know, one of the powerful pieces of this is often we move quickly, right? We move on to the next thing. And by having this kind of archive, these stories, it really is preserving what we have learned, the wisdom and the experience that's there. And so I feel like a takeaway is that, you know, we all kind of maybe had heard, oh, this happened in 1918, you know, the Spanish flu happened, but there were not sustainable lessons, right, over time. And here we are reinventing the wheel again with COVID-19. And so hopefully work like this and the ability now with things like websites and, you know, these different medias and technologies that we have, we can sort of capture in different ways that become real, that we don't forget, you know, what was there, and that can also contribute overall to the greater resilience that's out there. So one of our, you know, one of the things that came out of the Catalyst films is really thinking about a roadmap for the future. How do we not, you know, just sort of like had our experience and now we move on, and, you know, depending on what people might say about the pandemic, it's over, it's not over, et cetera. You know, how do we really think about this at a different level where it becomes a roadmap, a way to be flexible, to be adaptive, be creative? Maybe there were some of the old ways that we were doing that we were just stuck, and now we don't need to do that anymore. And so really, to me, that's one of the takeaways of work like this, is that it's a way that really bookmarks and offers a way to connect to the past and look towards the future.
Wow. Well, Dr. Villalobos, thank you again for your participation and your leadership and really helping lead efforts from the NALBA side of the equation And of course, we can't overlook the role of Enrique Lopez Escalera, because really none of us ever get to do this work in isolation. We do that because we have a team of folks who support us. We have the leaderships who support us, and it's a very meaningful effort. And all I could say is NALBA is very proud to be of support to that. And you can always count on us in the future for helping with the dissemination of the work in that roadmap, or whatever it is that's needed to really be able to come back to you all and say, let us know what were some of the things that you've learned now, and that we want to be able to continue to share with the community at large. But I want to give Dr. Villalobos an opportunity to do a takeaway too, right? Because she's been a participant here. Today, she's playing a unique role as a co-host, but really the truth of it is she's had her hands in the masa. So if she puts her hands up, you're going to see flour all over her hands. But it's because one is she's immersed herself in a way that's very powerful, right? Because she can deduce data, but she also knows people, and she knows exactly how that story can be translated in a powerful, meaningful way. So, Dr. Villalobos, just when you thought you didn't have to answer any questions yourself, we all get to ask you that question in terms of your takeaway, and then I'll make some closing comments after that. But Dr. Villalobos, please go ahead.
Oh, thank you. And I want to thank Dr. Lisa Cacari Stone and Dr. Pandhi for letting me be part of this Weave project. I didn't know, when you get into a research project, you see the protocol, you see the process, you know what the data analysis, the outcomes and the deliverables, but the impact for me was really sharing in the grief and the loss that these participants shared in their stories. And then with the team coming to a point where we were healing ourselves, because just as the frontline workers, they still had to do the work. They still had to be there for the community, as we were researchers still doing the work, trying to be safe for ourselves, but also being safe for our community participants. So I really enjoyed being a part of this team, and still being a part of this team as we go back to the communities and sharing some of the results and the outcomes of the wonderful work that was created through these digital stories and through the Catalyst films with Dr. Pandhi. And I think everyone will see, if they have an opportunity to go and see how impactful these stories are, because we did have an opportunity to show about 3 or 4 of the digital stories at our national conference for the National Latino Behavioral Health Conference in Las Vegas in September. And we had everyone in tears. So they are impactful. I invite everyone to go to the link that Dr. Lisa Cacari Stone shared, as well as Dr. Pandhi. Take a look at some of these stories, and they will resonate with you. They will help you through the healing process and understanding that we all went through some of the same things, but we are better on the other side as we are resilient, not only as each individual diverse community, but as human beings, as Dr. Lisa Cacari Stone put it. So I just wanted to say thank you for letting me be a part of this process. And I hope that we have a 2.0 for this particular Plática, so that we can talk about the scrolly telling and the Catalyst films when they are published and on the website. So thank you, Fred.
Oh, great. Well, here we are, right? Just as we started, right? We were all in anticipation of hearing all that's been going on and with the WEAVE program. But you know what my takeaway has been is the sense of dignity and respect for communities. There are so few institutional projects that have ever really kind of lived that by demonstrating it. And all I could say is it excites me because it gives hopes to our community that one is that we can really do these things together, right? Our mantra at NALBA is Juntos Podemos, together we can. And we when we lose sight of that, or aren't in that same space of doing it together, then it makes it difficult. And as Dr. Lisa Cacari Stone referenced several times, is the mutuality and the collectiveness of this effort has been phenomenal. Congratulations to you all for such success, and for more continued success, because I could say is it merits NALBA's support in ways that are very telling, right? Because we honor you as professionals, we honor your team for the hard work that's been accomplished. If folks really saw what was happening inside the kitchen, ¿verdad? Right? Because sometimes you're in the front getting served, but you don't really know what's going on in the back, right? I could simply say I use that analogy because one is we must give credit to those who are helping us and our communities get better and stay well. So with that, we'd like to invite you as the live Facebook audience to please continue to post and ask questions in there, and we'll be making sure we target this as an ad so we can spread this word out even further from today's Plática. So with that, muchísimas gracias. Thank you all, and we look forward to seeing you next time. Adios. Bye-bye.